she remembers more than me about that day.
About 5 months ago, I got a phone call that no parent ever wants. He'd been hit by a car.
My injuries were a broken coracoid in my shoulder, which ended up requiring surgery, which they put a screw inside, screwed the bone to the scapula. And then the other injury was on my leg, which was full clean break of the fibula and tibula, which left me in a long leg plaster for 6 weeks, then to patella tendon bearings where I could start to walk again.
It brought us into a whole new world, a world we hadn't considered, where we needed OTs, home care, surgeries, fracture clinics, x-rays, all these foreign words. It was just a whole new world to us. It was all very overwhelming, and it was all incredibly stressful. It was very hard to find out exactly what we were in for. And then when we got told little bits and pieces of what we were in for, it was, well, how am I going to manage this? How do we do this? Where do we go? Who do we turn to? What do I do? In the early days, we were in one of the bigger hospitals, which means they had all the equipment there that was needed. So you had access to chairs and commodes and lifting aids and so on. But it was decided that we'd be moved to a hospital closer to home. So for respite rehabilitation and just, I guess, waiting for the OT teams to be able to work with us to get him home. But this hospital was not an orthopaedics hospital. We had no access to mobility aids, no wheelchairs, no, nothing really. It was even suggested at one stage that he be sent out to another rehabilitation centre that's about an hour's drive and be out there for 6 weeks for rehabilitation.
Which distorted me a little because I didn't know what I was going to do, like 6 weeks by myself with none of my family around. But that changed as soon as IUI stepped in, which was glad that it happened.
So eventually the Indigenous liaison officers, who have been working with us from all hospitals, sent in a referral to guys at IUIH Connect, and within 2 hours they were by our bedside saying, what do you need, how can we help, we can get you home. Everything until that point had been so overwhelming, and trying to get information out of who, what, when and where wasn't that easy.
They started talking about how we can get home, how we can get everything we need.
They arranged for the hospital OTs and their own OTs to come out, and we did a home assessment in which they looked at various ways that we could have Tyler home and be able to get him around the house, get him safely in and out of the house, but most of all that he could be safe at home. So a wheelchair, a bed bar as it turned out, a ramp for home. They organised things for us such as even a handheld shower head and a commode.
Then the ramp came in like the day after, almost instantaneous, and basically they had it all set up.
Once he was home, the support continued, that they would check in every now and then to see if there was anything else we need. We were assisted with transport between the hospitals, or home and hospitals, because his visits were very, very frequent at that stage. As his level of care decreased, the lovely ladies at IUI pick up the phone every now and then and make sure we have everything we need, to see if there's anything else we need, how's it all going, and then just ask about our general welfare as well, not just the equipment we need.
Even now, after the 23 weeks, I'm still using the IUIH Connect services with the ramp and the shower chair to help me get on with life.
As the mother of a patient, the message I would like to give out is that families need to be treated as a whole, and you need to listen to the families, and that just makes the experience far less traumatic, because one patient's accident, illness or incident can affect an entire family. So to work with that family as opposed to just with the patient. When IUI asked us to speak to the Clinical Senate, we didn't hesitate. We felt that it was the least we could do, given all the support and help that they have given and are still giving us.
My name is Helen Quelch. I'm the manager for IUIH Connect for the Institute for Urban Indigenous Health. The IUIH Connect is a program that goes into hospitals assisting Aboriginal and Torres Strait Islander people when they've been in hospital. So when the client's referred, we see what their needs are. So they may be referred on to aged care services, they may be referred on to social services, mental health services, clinics, GP services, psychology, anything like that, physiotherapy, occupational therapy out in community, and we just try to make their journey from hospital to home easier and more streamlined.
Generally, if you think in-home care, you think aged care.
With Sharon and Tyler, we received a phone call from the Indigenous liaison at one of the hospitals, and asked us to come in, and that this young boy had been in a car accident, and his mother was actually a little bit stressed at the time, and could we come in and see what we could do and what services we could provide.
I had no idea that in a situation like ours they could actually help provide the equipment needed. They could help with transport, they could put referrals into place to community services, that they could just work magic.
The biggest thing I think was that they wanted to go home to a safe environment, and that was our biggest concern. So we got all the equipment that was required through the occupational visit and the physiotherapist, and then we supplied that, and so that Tyler could go home as quickly as possible. So supported by the registered nurse in the team, supported by the Indigenous outreach worker as well.
Having a service that cares for us as a family has been amazing. What was an overwhelming situation from the word go slowly decreased to be manageable.
When the client is discharged from the hospital, we make it more streamlined and culturally appropriate, and so that they feel confident and happy and secure when they go home.
As an Indigenous family, sometimes you do feel judged, and sometimes the minute you tick that box and they see that you've ticked you are Indigenous, the judgment starts. You're automatically looked at on the lower side of things. So to be able to deal with an organisation that is committed to raising cultural awareness and supporting Indigenous families is comforting, and you feel secure in the knowledge that you won't be judged, you will just be supported.
So IUIH Connect came about because there was a need for a service for Aboriginal and Torres Strait Islanders, so that they could get a good continuity of care from the hospital to home. And they do get support within the hospital, but where that, I suppose, that link to community that helps them sort of go through that journey a lot more easier. I think what the feedback is out in community is they see what we're doing and they think it's fantastic because it's got that the integrated model of care and the family wraparound sort of care. So we look at the holistic side, we look at the whole family. So when we do an assessment, we don't just look at the broken leg. We look at the whole picture, so the whole family. So what does everybody need? What support can we provide? Yes, we can provide some medical aids, but is there something else that is required? So it might be that mum might be very stressed as well from being going to and from the hospital. If we can make that journey a little bit easier, that's part of our job done as well, to just make that journey so much easier within the hospital, to give that support. support, and then make sure that they have that support when they come home as well, and get follow-up care. And it can be as easy as a little bit of transport or medication assistance or something like that. So we're doing that.
If I ever ended up back in hospital and needed different health services, I'd probably firstly contact IUI or any Indigenous liaisons, so they give me a hand with trying to find the right services and the equipment I'd need to get back to life.
And being in hospital isn't as, it's not an easy place to be, and it's very fragmented, and they don't always get what a family wraparound support, where with IUI Connect we give that wraparound care to them when they go home.
Well, Tyler's still not out of the woods. He's still got a long recovery to go, but we know that if we need something, we can just pick up the phone and they will find a way to help us.
We still know Tyler, and obviously he said 23 weeks ago, so we do make those phone calls just to check that everything's going all right. How's Mum going? How's Tyler's going? How's his recovery going? Is there anything we can assist with, to continue, his positive outcome for his care?
When IUI Connect stepped in, they worked together to ensure that we could come home as a family. They took the pressure off. It was a relief when they said to me, we can help you, we can get this equipment, we can help you get Tyler home, so that we could all come home as a family.
And which made me feel real great when I got home.
Cool.